Hi, I'm here with Dr. Rizwan Uppal, Chairman, Founder, CEO of Islamabad Diagnostics Centre in Pakistan.
I'm basically a practicing doctor today and a pulmonologist. I graduated in '94 and then till to date I'm into patient healthcare. I'm still actively practicing. I happen to be entrepreneur. IDC became afterwards. IDC started with a concept, with a vision. Once I started my practice independently in 2002, I realized that there was a gap. And the gap was one prescription that we write for the patients has multiple needs. Maybe I will be writing a blood CP, a blood sugar, a chest X-ray, maybe a CT scan. And the patient used to come back to me after 2 weeks with something missing. So I asked my colleagues to come and sit under one roof, which was definitely appreciated, but no one took this so seriously to come up. So I took the initiative myself that, okay, fine, we will do it because it is a gap waiting. And it was in fact a big gap waiting. So at that time, there were no diagnostic centers. So we enjoyed that first mover advantage, and within no time, it became successful. Although that was my vision at that time to come up like this, but I must appreciate my team and my initially two brothers, Dr. Rizwan Uppal, who was a great help to me, is still with me, and Dr. Imran, who is my other brother. So they trusted me and what I'm going to do, and then my team, who helped me to materialize this vision. Today, we are doing more than 7 million diagnostic tests every year, and the number is increasing every year. Our number of increase is more than 20% year on year, which is one of the fastest in the healthcare in 2 decades time, starting from just one small point, small lab. Today, we have 130 branches, and we are helping masses.
For those of our viewers who might not be familiar with the health system in Pakistan, can you share what healthcare delivery models exist and how IDC fits in this landscape, particularly in the field of diagnostics?
If you see in any country, to be more specific about Pakistan, as you're asking, there are hospitals, small hospitals, tertiary care hospitals, government hospitals, private hospitals, clinics, maybe polyclinics and labs. But there was a gap where there were no under one roof, everything sort of 24/7 facilities with the high quality diagnostics. So that was one element which was missing. So in Pakistan, at the time once we started, that was a structure, one missing element, and today we have diagnostic centers. So most of the patients that go to the doctor, that is outpatient driven healthcare delivery. For those patients who go to those OPD based clinics, they don't have good diagnostics available. So that was also one of the bases of start of the IDCs for that gap. So this is the healthcare delivery system today available in Pakistan. Now people prefer to go to labs and the diagnostic centers, get themselves diagnosed either by screening or maybe by getting referred from the physicians and then go back and get that good treatment in shortest possible time, very cost effectively.
Dr. Rizwan, in 2022, IDC implemented the total lab automation system at the main lab in Islamabad here. So can you tell us more about the driving force behind the project and how it aligns with the broader goals of IDC?
As such, to be very honest, once I started IDC, I had only small object in my mind to offer quality healthcare diagnostics only limited to my patients because I was starting practice at that time. So I never knew that one day I will be going for the total lab automation. Maybe if that was in my mind, much ahead of time. But the things started going very fast because the quality and the repute and the brand of the IDC started swelling much faster, and people started putting more demand on IDC. And as you may be knowing that even best human resource, best SOPs and everything, still there are human limitations. I'm not saying that without humans it is possible in any ways, but to overcome that, we started thinking about installing the total lab automation. I put that with my team and they all agreed, and we started very quickly to go with the total lab automation, one which solves our needs of offering quality diagnostics in the shortest turnaround time. So that made us decide to go in 2022 for total lab automation.
The total lab automation process implementation always so disruptive to the workflows. So how did IDC ensure business continuity while changes were being made to minimize the impact on patients?
That's very interesting, because that was my fear. Once we were planning to go for the TLA, how to go about it. You are running at a motorway with 120 speed, and how to change the engine, it's not possible. So there were two important things. First, I must appreciate the team who was going to implement that, and which impressed me, I must say. I will not hesitate to do so, that maybe double the time was taken to plan each and every smallest detail, how to go about on the papers before landing feet on the ground. So that was the one thing which saved us from undue, unpleasant surprises. On the other hand, IDC also once realized that this is something which is going to take some time. So we made a parallel lab to run along till the time that it was seamless transition from the previous labs into the new TLA. So practically no patient knew that something has changed or not. And hats off to the technical team, IT team, mechanical engineers who made that happen.
What kind of digital tools and IT functions are used to complement the TLA system? And what was the thought process behind deciding which digital tool to use?
As such, you must be knowing that it's not possible to deliver good quality healthcare without the help of the digital technology, and it has become more and more imperative every day passing. We have our own IT solution of IDC, where we interface that with the lab analyzer, but once we installed the TLA, we used the best one for IT technologies, which can auto-validate the results, which can see the delta curve variation and help us validate to digitally sign the reports as well. Not only that, but also just to see the controls and calibration of the remote labs beyond the TLA. So I often say that my TLA is helping me beyond this by controlling those 25 small labs, stat labs, by getting the controls and other values from there. It's a great help, I must say. Not only, I will further add here, we can send these reports through our own apps to the patients, where not only they can see lab reports of today's reports, maybe 3, 4, 5 previous reports with the graphs, and also radiology reports with the DICOM images. So a lot of IT and digital tools are being used, and mostly they have become available once we have started TLA.
So with TLA implementation, how does this work in the broader IDC network of 25 satellite labs that the IDC has established?
We have established 25 labs there and 130 branches across Pakistan first. All these are connected through this, as I was saying, through the IT solutions. And I feel that just making collection points is not that good option for the patient, being a patient-centric entity. So if you are patient-centric, you have to make more labs, keeping in view the turnaround time, instead of just making one big reference lab. Yes, of course, you need big reference lab more. Installed the second one in Lahore. So we have 2 TLA labs out of probably, if I'm not wrong, there are total 10 TLAs till to date in Pakistan. And only we have, and 2 of them are with IDC.
IDC has a clear focus on health education with the public. And it was also acknowledged by the government during COVID time as well. So can you provide more information on this initiative and why it is important to IDC?
You know, without that education, we are not able to let people know what we are doing. So we have made that different verticals. For example, education for the professionals, where we are into undergraduate education with the medical colleges and the universities, and our people go, and we are affiliated with ISRA University and few other universities as well, where we go for the education as well. Secondly, we are also into postgraduate education, which is one of the most difficult part. And we are the only center in Pakistan, private center, who is affiliated with the College of Physicians Surgeons of Pakistan for FCPS Part 2 in radiology. So we are into that as well. So that is the education for the medical professionals. We also train to people who are into medical technology and radiology technology for their internship and training. And lastly, the most important are the patients. We want that patient should know what treatment and what is going with them. So for that, we have established the channels for the media, social media channels for education on different diseases. We also keep informing them through other communication portals, educating them what is actually happening.
Healthcare is best delivered on the long-term outlook. So how are you working towards creating a sustainable future for IDC and communities in Pakistan?
Let me start from community. As we say, a healthy body as a healthy mind. So healthy people in a community make healthy society. And these healthy societies then make healthy nations. So if our people are healthy, we can help contribute in making Pakistan a good society, a strong nation. Even for the finances of this nation, if people are healthy, they are not going to drain. Instead of becoming a burden on the nation, they are going to contribute. So that, I feel, is where we will be trying to play our little part. In the way forwards, I see Pakistan is a big country, 250 million population, and healthcare is quite fragmented as well. Government is trying its best. So many good private setups also coming up. The mushroom growth is going down. So I see we have yet to do so much. And we have plans to roll out further. We have plans to assist the healthcare setups who need diagnostics, and we are doing that in relations in the JVs with them. We are one of the most favorite for any new small to medium to large hospital setup to offer them diagnostics as a module and go and synergize with them. So this is my future, that infrastructure of the IDC goes along with the demands of this nation. For that, we are going to come through various verticals, not only as a private diagnostic network of 130 branches, but also by helping the small hospitals, big hospitals, by making joint ventures with them, giving them labs there, giving them radiology there, also helping government through public-private partnership. We did 3 big labs in Attic, Jhelum and Chakwal, where we were doing 1 million diagnostic tests every year for 3 years. And we gave so much subsidy to the government was compelled to give that free of cost to the patients. So we were pivotal in offering free diagnostic tests through government and these areas. It went so well that government is again asking us to come up in radiology and also lab this year. I have great and high hopes. I usually don't use the word proud of. I'm humbled, but I will say I'm proud of that, to have such a wonderful team with me. I just had a vision. This vision cannot be materialized into a mission if you don't have good people alongside. And I really respect my team, each and every one, in the lab, from reception till every level, every tier of IDC.
Thank you so much, Dr. Rizwan, for your time. It's always been a pleasure speaking with you.
Thank you very much for coming. Thank you very much.